Thank you very much. Let's give it up for Pamela Creekmer, our new health secretary here at Prince George's County. I want to thank you very much for accepting the invitation from our county executive, Sharon Baker, and Dr. Sharfstein to serve the people of Prince George's County in one of the many areas that are so vital in terms of services and programs and initiatives that government offers. We don't do it alone. We do it in partnership with the private sector. And second, perhaps only to quality education, is quality health, public health. They all go hand in hand anyway. You can't expect anyone to learn if they're not healthy. And we know that there's a correlation between education levels and health. And, you know, I can't explain it. That's out of my field, but we know that. So thank you very much for your service to the people of Prince George's County. Thank you, everyone, for being here this evening. We really appreciate it. This is important. I am so excited that tonight we're talking about Health Enterprise Zones. You're here not only because you're going to learn more about the Health Enterprise Zones, but because we need your help. We just created this program in the spring during the legislative session. And right now we're in the process of developing the regulations, the criteria, in order to successfully implement the Health Enterprise Zones. And we can't do that in a vacuum. We do it with input, ideas, suggestions, even the concerns or criticisms that you have at the program that I hope you raise tonight, because they have been raised in other fora. We've had them in Baltimore City. We've had it already in Montgomery County. I think we've been one other place. This is our fourth one. Even those criticisms, critiques, concerns enable us to take a closer look at what we're doing to make sure that we get it right. This is an important program. Maryland is the only state in the country that has ever established a program like this. For years, decades, states throughout the country, the private sector, providers, payers, carriers have been addressing health disparities. And they continue to plague our communities. I remember when I was a little boy growing up, my father's a doctor. I remember I'd go to his medical practice on Depot Road in Huntington, New York. He worked late hours. You know, that's the time when they did the house calls, hospital rounds, weekends and evenings. He loved his patients. He woke up every day, cheerful. He wanted to go out and make a difference in their lives. He'd come home every evening. He'd tell us a little bit about his patients, the wonderful people that he met, the difference that he made in their lives, and he'd be a whole lot more weary. And he'd get up the next day and he'd do it again and again and again and again. My father's services that he provided, many of them never went paid for. I remember when I went to college, I came home, I saw a file cabinet in the basement in the home where we live. I opened it up. For those of you who are in the legal profession, that was before the days of HIPAA. There were no regulations that were being violated at the time. It wouldn't happen today. And I saw a lot of invoices in this file cabinet. A lot of them were unpaid. And these were invoices, unpaid invoices from patients that he treated. And if my father had not provided that primary care service in that community where we grew up, they wouldn't have been provided. Access to care is one of the determinants, or lack thereof, of health disparities. There are a lot of others. There are other social determinants. The Health Enterprise Zone is focusing on the health care or medical determinants that contribute to health disparities. We're going to create zones, not at the state, not in Annapolis or not in Baltimore. We're not going to pull out a map and say, okay, there's a zone here and there's a zone here. You are going to do that. You, the local health departments, if you choose, working with nonprofit entities, not exclusively, but as applicants, reaching out into the community to bring in whoever thinks that they can be a benefit to this zone. You'll define the zone. We'll establish criteria. We'll say, look, we want to try to do this, we want to do this, we want to do this. You come in and you say, this is a zone where we think that we can make a difference. There are disparities that exist here, and these are the resources that we, the nonprofit, the local health departments, the providers, will bring into the zone. This is our contribution to address health disparities. And then as a state, we're going to provide incentives to help that strategy work. What do I mean by incentives? Well, we may provide property tax credit, income tax credit, hiring credits, grants for equipment purchases or improving property in order to make the clinic or the facility more welcoming and effective for treating and seeing and enhancing services in that zone. But the beauty of it is we don't even tell you what incentives you need to use. We got a laundry list of incentives with dollars behind them. Some of them include repayment assistance for physicians that may come into the zone. The applicant will tell us what incentives that the applicant wants to use in order to bring additional resources into the zone. So you may have a provider who's already in the zone. Maybe a little physician practice group. There may be a health clinic in the zone. There may be a hospital outside the zone that can develop strategies to bring enhanced services in the zone. And those three entities may come together as an applicant. The provider group might say, hey, if we hire 2 more nurses, we can do this, this, and this. And they might say, we need some hiring tax credits to make it happen, okay? The hospital might say, we can get another physician in right out of medical school who's a primary care physician, okay? But we need a little bit of help to repay that medical school loan, okay? So that's another incentive. You may have that clinic that says, we need to purchase a new medical device or equipment. And they might say, we want to use some of that grant money available. They'll develop the strategy. They'll say, these are the chronic illnesses and the diseases that we're going to go after and that we're going to improve upon. This is our strategy. This is how we're going to measure success. And those are the incentives that the state's offering that we're going to rely on. And in 3 years, because it's a 3-year program, we'll come back and we'll demonstrate that it works. And when we do, we will prove to the world that if you incentivize behavior, you can make a difference when it comes to enhancing the delivery of primary resources, health resources in a community to address disparities. The days of talking about eliminating disparities, they're over. Other states are still talking about it. Maryland is putting $4 million behind this program. Another thing that we didn't do, we didn't say where the zones are going to be. The most competitive applications will be awarded the zones. We didn't say how many there will be. It's my belief, it's my hope that we have from 3 to 4 zones. I'd love to see one in an urban core, right? We want to prove that it works in a dense urban area. I'd like to see one in a rural community because we've got disparities in rural communities as well, geographic disparities. I'd like to see a zone in a culturally and linguistically diverse community because that is often a barrier to a service as well. Because in 3 years, we want to be able to say this concept works to address disparities, healthcare disparities, wherever they exist. I wake up every morning in Prince George's County. What I'd like to say is, I'd like to see a health enterprise zone right here in Prince George's County, but I can't say that. But he did. Oh, there he is. There's the county executive. But you know what I like about this program and why I think that Prince George's County is going to be very competitive? Because the county executive has a new initiative called the Transforming Neighborhood Initiative. And in many ways, it's like the Health Enterprise Zone concept, but on a bigger scale. It's saying we've got to target communities where when we bring more resources, we're going to see improvements in public safety, in public health, and in public education. This program, the HEZ, it is consistent with that concept. And that's why I think that Prince George's County will be very successful in making application for a Health Enterprise Zone. So we need your help because you just heard me sort of fumble through and try to articulate a concept. And yeah, what I just tried to describe, we've got about a 15-page piece of a document that outlines it. But the details we're relying on you to help us establish those so we can have a successful program. So thank you for being here this evening. I look forward to coming back in 3 years. I'll be back before then. But in 3 years, saying, look how successful this program was. Thank you very much.
Thank you.